Okay, sorry there. Okay, thank you to everybody for being here for this conversation, and we'll just jump right in. Health, of course, has always been a top priority for Ontarians, but sadly, our healthcare has never been in such a state of crisis. Beyond health policy, Ontarians' health is deeply impacted by other policies, especially anything failing to reduce greenhouse gas emissions and control the climate crisis. So this is our chance to vote for better by understanding those connections. And please post your questions in the Q&A as we go through. Now, to begin with, Ontario has the lowest public health funding per person anywhere in the country. And yet our budget increases are not even keeping up with inflation, not even close. Furthermore, the healthcare budget is not being spent in full. And finally, the public money we do have is partially flowing into privatizing public hospital services. And all of this is undermining our healthcare. Despite a healthcare worker crisis, this current government passed a bill in 2019 capping wage increases for public health and other public sector workers. It was struck down as unconstitutional by the courts, despite the government appealing. This cap was imposed on public sector health workers only, while for-profits were not capped. Let's look at privatization. A record number of healthcare privatization lobbyists have been registered under this government. Operating funding for public hospitals, for example, increased only 0.5 percentage point last year. By comparison, one of the only two for-profit Ontario hospitals received a funding increase of 278%. And the lobbyist acting on their behalf was none other than the former Minister of Health from this government after exiting the ministry. Furthermore, this government has not curbed the practice of for-profit staffing agencies that are charging up to triple the price for exactly the same staffing and service employed in the public system with our tax dollars. So the bottom line on health privatization, with the very best evidence and studies that we have at this time, privatization reduces the quality of healthcare and worsens health outcomes. And that is something to really consider when we are deciding how to vote. So let's look at where we are with health outcomes after 7 years of the current government administration. Ontario had the lowest number of hospital beds per capita in Canada in 2022. We're projecting a shortfall of nearly 14,000 hospital beds and over 80,000 staff by 2032. Despite a campaign promise to end hallway healthcare, the numbers doubled between 2018 and 2024. And despite the vast majority of our hospitals, these are now running in deficit almost exclusively, which is very concerning. And we have seen unprecedented closures of vital services. Over 1,200 times we saw closures of ERs, ICUs, and labs in 2023, which is not acceptable. And the number of Ontarians without a family doctor has skyrocketed from 1.8 million in 2020 to 2.5 million now, and a staggering 4.4 million projected by next year. Now, let's move from health policy to, I'm not sure what happened here. From health policy to the impacts of climate and climate policy on our health, with the understanding that climate change harms our healthcare systems as well as our health. Take a look at this massive pharmaceutical plant that has been damaged in a tornado. Events like this can have ripple effects with shortages of drugs and medical supplies for over a year and are getting more common. Have a look at the upper panel with this fireball, a wildfire threatening the Yellowknife Hospital, which had to be evacuated in a military operation with a patient dying during the evacuation. And in the center of it all, our healthcare personnel becoming overly stressed and burnt out. Looking now at the harms to our health itself, every time we burn fossil fuels, we're producing health by two pathways: the carbon pollution pathway that leads to climate change, and the air pollution pathway that releases toxic particles and gases which harm our health. If we look at the carbon pollution first, hands down, we now understand that climate change is the single greatest threat to our health of the 21st century, and that our very survival is at stake. This blue map from the Canadian Medical Association shows impacts right across the country. This ranges from extreme heat, which killed over 600 people in the BC heat dome. Forest fires, we've lost Jasper. We've seen Los Angeles devastated. This is all over the world. And harm to housing and food security, which are social determinants of health. We know that about 60% of infectious diseases are going to be worsened by climate change, which is simultaneously increasing antibiotic resistance. So the medical community is very, very concerned. And now let's look at the health harms of that air pollution pathway. Around the world, over 8 million people are dying every year now due to air pollution, which translates to over 15,000 Canadians and nearly 7,000 Ontarians every single year. And this happens because when we breathe in this polluted air, it, of course, enters to our lungs and causes severe lung diseases, but then it passes into our bloodstream where it can cause serious heart diseases, brain diseases, multiple forms of cancer, risks to pregnant women, such as birth defects, and to babies. And both pathways, climate change and air pollution, lead to devastating mental health harms that especially affect our youth, and even to the point of causing depression and suicide. And we have high levels of evidence for this. Let's move now to look at the impacts of energy policy on our health, and it is critical. We just heard from Dr. Winfield. Fossil fuel-based energy policies such as gas are expensive, but also harmful to human health, as I just mentioned. Nuclear energy, very expensive, as we just heard, exorbitant cost, too slow to meet our urgent energy needs, but also Canada to date has no permanent solution for the decades of accumulated radioactive nuclear waste. Experts are deeply concerned with the health risks of proposals like the Chalk River repository and northern deep geological repositories. And there's a lot more we can talk about if you pop your questions in the Q&A here. Let's look at housing, which is fundamental to health. Under the current government, homelessness has risen to record highs. The Auditor General has clearly identified that this ministry does not have a good strategy for the reduction of homelessness. This is increasing the risk of communicable diseases. TB is on the rise in Toronto, and there's increased usage of fire, paramedic, and emergency room services. So not only is the unhoused person suffering, this affects all of us. Sorry about that. Under the current government, new housing starts are at a 69-year low. And the More Homes Built Faster Act floated by this government not only tried to build over the Greenbelt, but it also contained legislation that undermined affordable housing and renters' rights in many ways that actually were not reversed. We know that supportive housing costs only $500 a month. Compare that with $12,000 for a hospital bed or $9,000 for prison. If we could permanently house 3,000 emergency shelter users in Toronto, we would save $60 million a year. So housing people, it is healthier, cheaper, and safer. And finally, let's look at food as well, being fundamental to health. Food bank use as well under this government has risen to record highs due to cost of living, poor employment opportunities, and failing government support programs. And poor climate policy, which drives the climate crisis, combined with current land use policies, which are destroying over 300 acres of farmland every single day, disrupts Ontario farmers' abilities to grow food. And we're going to hear from Brent right afterwards all about that. This increases food insecurity, which harms our health directly. It damages our food independence if we want to grow local, eat local with the threat of US tariffs. So let's vote for a better future. Let's demand and vote on strong policies that protect our health by protecting our environment. And this is our chance to make it happen together. Go out and tell your friends. We've got 2 weeks left to make this happen. Thanks so much.